All right, so we're going to be performing the peripheral vascular examination of the upper and lower extremities. First thing I'm going to do, start at the upper extremities. I'm just going to observe. On the top, patient can just be like that. Perfect. Just observing for any marks, any discoloration, hair patterns, and it looks normal to me. Next, I'm going to bilaterally assess for temperature. So just be like that. Perfect. So from here, feeling for any temperature differences. Okay. They feel normal. Next, I'm gonna have you have your hands on your lap. We're gonna do the nail compression test. So take the fingernail, I'm gonna compress and let go. I'm gonna return to normal, the color. Same thing on this side. I'm gonna compress the fingernail. It's white. Let go and the color returned. Now we're gonna do the hydration test. So skin at the back of the hand, pinch it, let go. That's the normal response. Same thing on this side. There's no tenting. Normal response once again. Now we're going to move on to the pulses. So, patient, I'm just going to have you flip your hands. Get down here. We got the radial pulse first. So, bilaterally assess the rate, rhythm, amplitude, and they both feel the same. Okay, I'm going to move on to the ulnar pulse. Again, feeling the rate, rhythm, and amplitude, and they both feel the same. Next, we're going to move to the brachial pulse. So it's just right here, and they both feel the same. And now, I'm just going to feel for any lymph nodes between the biceps and the triceps, just here, feeling for any nodules. There's none there. Good. Same thing on this side. Feeling between the biceps and the triceps. Any nodules, and there aren't. Okay. Now we're going to move on to the axillary lymph nodes. So, patient, just going to have your arm over my shoulder. Okay, just relax. Okay, we're going to feel the anterior lymph nodes, which is just behind the pecs. So, feeling for any nodules. There aren't any. We'll do the posterior lymph nodes, and I'm going to feel just in front of the subscapularis. There aren't any. Now I'm going to do the medial, so feeling right on the rib cage, feeling for any nodules, and there aren't any. And then are you ticklish? Sorry.
A little bit.
And we're gonna do the lateral, just by the head of the humerus up here. Okay, and I performed that on the other arm too. Now we're gonna do Allen's test. So patient, I'm just gonna have you do this and then squeeze your hands. A few more squeezes. I'm gonna compress the ulnar and radial arteries. Keep squeezing. And let go. Let go of the radial path, and the color return to normal. We're going to do the same thing. So squeeze, squeeze. This time I'm going to block off the ulnar path. Okay, good. And let go. Perfect. And return to normal. Once again, I perform it on the other hand too. And that concludes the upper extremity portion. Now we're going to move on to the lower extremity. So patient, can you just lay down, face up, and for your shorts, could you just roll them up as high as you can? Step one, just going to inspect from the inguinal ligament down to the toes, looking for hair patterns, skin discoloration, any marks, tattoos. Got one there. Any abnormalities, really. Now I'm going to bilaterally assess temperature again. So patient, I'm going to start at the top of your thighs and go down to your toes. Is that okay?
Mm-hmm.
Just like that. checking to see if there's any temperature differences. Same thing on the medial aspect. Okay. Now I'm going to do the pitting edema test. So there's 3 different areas. First one at the top of the feet, so right here. Hold down that area, let go. For any indentation, it's normal. Next one is just behind the medial malleolus. Same thing, I'm gonna press down on the area. Let go, return to normal, checking to see if there's any indentation. Last one on the shins, press down, let go. Once again, normal response, no indentation. Now I'm going to compress the nails. So toenail right here, I'm gonna compress it, let go, color return to normal, perfect. Same thing on this side, compress the toe, let go, and the color return to normal. Now we're gonna move on to the pulses. So first one is at the base of the big toe, just lateral to it. So I'm gonna bilaterally assess both, assessing the rate, rhythm, amplitude, and they're both the same. Next, we're gonna move on to the tibial pulse. So just behind the medial malleolus, assessing for rate, rhythm, amplitude on both, and they both feel the same. I'm gonna do the popliteal, so I'm just gonna raise this just behind the knee. Perfect. And this one. Okay, perfect. Now the femoral. So I'm just gonna have you top of your shorts, just roll it down a bit. Perfect. And the femoral. Okay. And since I'm already in the area, I'm going to assess for lymph nodes, so feeling for any nodules, and for herniations as well. I'm going to feel for any lumping, which I don't. I'm going to auscultate the area too with my stethoscope, using the bell side. Checking for any bruits. Okay, that's normal. Once again, I do it on the other side as well. Now we're going to move on to the special tests. So first one, just gonna dorsiflex the ankle, squeeze the calf right here. Patient, is there any pain with that?
No.
Okay, good. Same thing on this side. Dorsiflex the ankle, squeeze the calf. Any pain with that?
Mm.
Okay. Now we're gonna do the leg elevation test. So bring your feet together, lift them up, just like that. And as if you were swimming, I want you to wiggle your toes. Yeah, there you go. So keep doing that. I'm just doing this so the blood flushes. Feet are already turning more pale. Just a few more seconds. Now we're gonna calm down. You can sit up. Come down right here. And the color's already returning. It's going back to normal, which is the appropriate response. Now we're gonna do the venous tap test. So patient, I'm gonna have you stand on the table. Careful. So one hand on the medial knee, other hand just below the inguinal ligament right here. I'm going to be tapping, and I'm feeling for any impulses down here. Same thing on this side. Medial knee, inguinal ligament just inferior to that. I'm going to be tapping. I'm feeling for any impulses, and both of them were normal. And you can come back down. And that concludes the peripheral vascular examination of the upper and lower extremities.